Hello and welcome to our second to last PowerPoint module for this semester in this course. This week we're going to talk about social networks and relationships in relation to health. Our objectives for this week are to consider the role of social networks, social integration, and social support in shaping health. And on the outset, all of these things might sound like the same thing, but we're going to also talk about distinctions between these concepts. I estimate that this module will take about an hour. Here are your deliverables for this week. As usual, you have your reading question due Monday night. You have your PowerPoint module due Tuesday night. It involves 3 responses throughout the module. And you have no assignment due this Friday. I also want to point out that, as stated on the syllabus, we have no class on Wednesday. Okay, so this is the 3rd spring break day of the semester, which means that all students are going to meet on Friday on Zoom. Okay, and this is the last time we're going to do this during this semester. Okay, so no class on Wednesday, all students meet on Zoom this Friday. Before we get started for our topic for this week, I also want to mention your course paper rough drafts. You do have feedback for your rough draft on Inquire. Okay, so go check out the feedback that you got. You'll notice that on the first page of your rough draft, I've put a projected final paper grade on there. So out of 50 points, this is how many points you would get if you make no further revisions for your final paper. Okay? So this may be useful to you in making decisions about how to revise or whether to revise, how much to revise your rough draft. Here's some more general feedback that I gave, or general things to look out for, because these were the most common among the rough drafts that I received. First, make sure you're drawing connections between the distal and proximal determinants of the outcome that you chose. And you should cite evidence here if it exists. If you have trouble finding evidence to draw connections between the distal and proximal determinants, first consider why that might be the case. Is there something missing in your description of distal and proximal determinants separately? Or if those connections really just haven't been examined in the research, then you're going to have to get a bit speculative here. So you might have to say that you speculate or you believe that there may be some connection between said distal and proximal determinant. And if you have questions about this, we can certainly discuss it one-on-one, okay? In addition, make sure that you're discussing specific interventions that have been used or could be used, citing evidence throughout. Okay, so saying something really general about, well, increasing access to healthcare might help. Okay, well, is there evidence to support this? What do you mean by increasing access to healthcare? How would you go about doing this? Are there existing programs that have worked in increasing access to healthcare in the way that is needed in order to reduce the burden of disease for the health outcome that you chose? Okay, so do more than a few sentences here in discussing interventions. Also, make sure you're using scholarly sources. So I noted in your annotated bibliographies and in your rough drafts, if it was the case, that you weren't using scholarly sources, or I listed which ones did not appear to be scholarly sources. If you have questions or you're not sure about what you're using and whether it is a scholarly source, please talk to me. Also make sure that you are using in-text citations to cite all information that is not considered common knowledge. Even if you cite something in the sentence before and you're still talking about that thing, that same source, make sure that you're citing, because it might not be clear to me that you got that information from the same source. Finally, avoid relying on using direct quotes. Okay? Instead, try paraphrasing. Okay, so paraphrasing sources, that means taking what is said in a source that you're using, putting it into your own words in your write-up, instead of directly quoting what you're finding. Okay, and this is more of a stylistic thing. So if you continue to use direct quotes and you have a lot of direct quotes, it's not an academic integrity violation, but it just isn't really a good academic style of writing. You want to try to paraphrase as much as possible. This is the general feedback that I gave on the rough drafts. If there's any specific feedback that I gave you and you want to discuss it further, please do let me know and we can set up a time to talk during office hours about your paper. Okay, last things I want to mention before we get into our topic for this week. I've decided to make a couple of changes to upcoming assignments for a couple of reasons. First, we have moved to all remote, which does change the feasibility of doing some things moving forward. And also, I do want to lighten your load just a little bit at the end of a very unusual school year and an unusual semester, okay? So first, here's our first change. If you are happy with that projected final paper grade that I put on your rough draft, right? That's the thing on page 1. I said, if you don't make any changes, you just turn this in as is, this is the grade that you would get on your final paper. If you're happy with that projected final paper grade, you do not need to turn in a final paper. If you don't turn in a final paper, I am going to take the projected grade that I put on your rough draft and I'm going to make that your final paper grade. Okay, so if you are happy with this projected grade, you do not need to turn in a final paper. I'm just going to use the rough paper projected grade. Second thing, because we aren't meeting in class anymore, I'm going to make your final exam a take-home exam, which I hope does take a little bit of the pressure off for final exams. Just like with your midterms, you're going to have several days to complete your final exam. I'll post it several days before. You do need to turn your completed final exam in at the end of our final exam period, and this is just college policy. All right, so the end of our final exam period is May 17th by 12 p.m. It's a little different from the other deadlines that we've had in this class. It's not 11:59 p.m., it's 12 p.m. on the 17th. If you have any questions about the final exam, we can certainly discuss this in class as well. Here's your opening question for this week, and this is more of a reflection question for you. In what ways has the pandemic affected the social connections and support that are available to you? What strategies are you using to stay connected to others during the COVID-19 pandemic? The reason I'm asking this is in part just to give you the opportunity to reflect, but also to point out how what is happening right now with the pandemic is absolutely affecting the way that we connect with one another and the strength of the social ties and the ability that we have to foster those social ties. So please just reflect on this, share whatever you're comfortable with sharing, and this will be your opening question. Now, before we get into some of the research and some examples of the connection between social relationships and health, I want to go through some vocabulary because there are a lot of terms that seem interchangeable that are used in public health and sociology research about social relationships, but they actually are quite different, even if they are measuring somewhat similar things. So the first term is social network. And we can think of social networks as really this web of ties between ourselves and others. So if you think of your social network, you could think of it like a spider web, right? You have yourself and you are connected to this person who's connected to this person, connected to this person, and there's probably some crossover and overlap. That is a social network. We're considering the number of social connections that a person has and the interconnections between connections, if that makes sense. The image on the bottom right corner of the slide is one way that you can at least envision a social network. It's these interconnections between individuals. One associated term with a social network is social contagion. And this is when a behavior, an attitude, or an emotion travels between connections within a network. And maybe we're going to see some clusters within a network that have a shared behavior. Maybe it is diet or physical activity.
we have seen that there's some evidence to suggest that eating behavior is somewhat networked in a way that maybe we tend to gravitate toward people with similar eating behavior, other health-related behaviors as us, or perhaps one person's behavior does affect the behavior of another. You might think of this in intimate partner relationships, where one person's bad habits might creep into the partner's habits as well. So that's social contagion. Social integration or isolation, these are kind of opposites of each other. This describes the extent of connection or disconnection to social groups or institutions. I know that's pretty vague, so let's think of some examples here. We could be referring to the frequency of social interaction, so maybe the frequency in which you interact or talk with your family, with your peers. We might also be thinking of dimensions of social interaction. So beyond interaction with family, maybe religious attendance as a dimension of social integration, engaging in recreational activities or regular organization meetings or volunteering. These also could be considered dimensions of social integration. And then on the flip side, that is lacking these social interactions, right? So having few family members that you interact with, or having few peers, or not attending organized events, that would be social isolation. So the first two, social networks and social integration and isolation, these are more quantitative assessments of social ties, right? How many contacts do you have? How often do you interact with such and such person? How often do you go to religious services? How often do you engage in recreational activities? These are more quantitative, right? There's a number that we can attach to those. Now, the latter two bullet points on this slide are more qualitative in that we are assessing the quality of social relationships or perceptions of social connectedness. So social support or strain, this is an assessment of the quality of social relationships, perhaps how much you feel supported by family, how much you feel supported by your peer group. These would be very vague, but these would be questions relating to social support. On the flip side, we could think of social strain. So do you feel that you are not listened to by family or peers? That could be a question related to social strain. And then the last one on here is loneliness. This is a sense of disconnection or isolation from others, right? So this is more of an emotional state than it is, a way of, it's not really a quantitative measure. This is a self-reflection of one's own feeling about connection or disconnection. All right. This is not a complete list of all the terms that exist in the social relationships literature, but I wanted to give you a sense of some of the more nuanced measures that exist and how they do really capture somewhat different things. All right, so let's talk about a research example of assessing the connection between social relationships, so some of the measures that were mentioned on the previous slide, and health. That is the question now. How do social relationships relate to health? One of the studies that you read for this week is called Social Disconnectedness, Perceived Isolation, and Health Among Older Adults. So we are looking at older adults here and looking at the relationship between these social connections and health. There are two measures that the authors use, Cornwell and Waite are the authors, that they use in order to assess social relationships. The first is, as it says in the title, social disconnectedness. And this is a quantitative assessment of social connections. We're including the size of a social network, the number of friends, which is self-reported, and also frequency of social participation, so attending meetings, socializing with friends, or volunteering. All right, so this is the more quantitative assessment. In addition, they have a measure of perceived isolation, and this is more qualitative. Here we're assessing the quality of relationships, including perceived loneliness and perceived social support, right? So these do capture different elements of social relationships and measure them in somewhat different ways. but do broadly capture elements of social connection and social relationships. All right, so next couple slides, we're going to see what they found. Here's the first figure in the Cornwell and Waite article, and this is showing us the relationship between social isolation and the probability of reporting very good or excellent physical health, right? So these are the more positive health outcomes, very good or excellent physical health. And what we see generally, before we even break it down any further, as social isolation increases across the x-axis, the predicted probability of reporting very good or excellent health decreases. And then if we break this down further, we see that it's true for both perceived isolation, so that's one's perceptions of their social relationships or lack thereof, or lack of social support, right? We see that for social isolation or perceived isolation, and we also see it for social disconnectedness, and that's that more quantitative measure of the number of friends, number of contacts, frequency of engaging in social activities. And these are very similar in their trends, right? So we see as social isolation increases, whether it's something that is measured quantitatively or more reflectively or qualitatively, as isolation increases, physical health declines. That's the takeaway from this figure. Here's the second figure from the Cornwell and Waite article. And here they're doing essentially the same thing, but instead of looking at physical health, they're looking at mental health. So the relationship between social isolation and the probability of reporting very good or excellent mental health. We see the same overall trend, right? Increasing social isolation is associated with declining mental health. However, we see more of a difference here if we look at perceived isolation compared to social disconnectedness. There is a negative association for both of them, but the slope is a lot steeper for perceived isolation. So it appears that the relationship between perceived isolation and mental health is stronger than the relationship between social disconnectedness and mental health. And we could hypothesize why we might see this. Perhaps one's own perceptions of their social support networks. Maybe this is especially salient for mental health. It's how somebody interprets the networks that they do have. It's how someone interprets the support that exists for them. Or maybe we could think of this as a situation of reverse causality, right? Somebody who has poorer mental health may be more likely to perceive less social support or perceive fewer social connections, right? And in that way, the causal relationship here is a little bit hard to establish, right? Correlation does not necessarily mean causation. And this is a big issue within the social relationships and health literature. Does a lack of social relationships or social support, does that lead to poorer health, or does poorer health then lead to a lack of quality social relationships and support? That's a really big fundamental question. So let's move on to another example now. And this example was actually discussed in the Galea book, the chapter on something about social connections. Galea talks a bit about the connection between social isolation and addiction. As you are aware of, and as we have mentioned in class a number of times, we are in the midst of an opioid crisis, right? And we can broaden that to talk about an addiction crisis. There is some evidence to suggest that the addiction crisis is in part being driven by social isolation and increasing levels of social isolation. Now, one important thing to consider or think about before we get into some of the evidence examples that we're going to talk about is the intricacies and the complexity of the relationship between social isolation and addiction. It is actually bidirectional, because we can think of social isolation as predicting the development of substance use disorder or addiction more broadly. And at the same time, addiction also in and of itself is an isolating illness, right? Addiction contributes to social isolation so that the affected person can continue to engage in addictive behaviors. So this is a cycle, and this is bidirectional, which makes it actually all the more difficult to be able to treat and manage. Let's apply this idea of the connections between social isolation and addiction to what's happening right now with the coronavirus pandemic. Um, as you know, this is a very isolated time. And thinking about those with substance use disorder or those at risk of substance use disorder is very important at this time. This is a map of Virginia, right? And here we are looking at the rate of substance related overdose, whether it's opioids or some substance that's not specified. And we're comparing the first quarter of 2019, which is January through March of 2019, to the first quarter of 2020. So January to March of 2020. What is the change from 2019 to 2020 in the overdose rate? And what you see here is that in all regions of Virginia, there has been a steep increase in substance-related overdose in 2020 compared to 2019. 16% increase in Southwest Virginia, and that is actually second highest to Northern Virginia with an increase of 33%. So big increases. This also appears to occur for both men and women and across most age groups. The exception is ages 45 to 54, but in all other age groups we have seen this increase. And that then leads us to wonder, does this have something to do with the social isolation and more general social unrest that is taking place this year due to the coronavirus? Here's another figure from the same report coming from the Virginia Department of Health. And this is showing us the year-to-date rate of emergency department visits for either opioid or unspecified substance overdose by year and health region. So here we're looking at something somewhat similar to what we were in the previous slide, except obviously here we have a graph and not a map, and we are also breaking this down by year and by region. And each year we're looking at the same time of year. So it's each year from January to March. And you can see that there are, for every region, it appears that there are some peaks pretty early on in 2016 and 2017. And then for most regions, there was a decline in 2018 and 2019. We started to see a reduction in the overdose rate and in emergency departments due to overdose. And that is encouraging. However, we see in 2020 that we have returned to previous levels, and in the case of Southwest Virginia, which is where we all are, unless you are working remotely this semester, but Southwest Virginia, including the Roanoke area, we have had the biggest spike since 2016, right? This exceeds what we have seen in the previous 4 years in terms of ED visits for opioid or other substance use overdose. This is alarming, right? Because there have been a lot of efforts over the past few years to get this opioid and addiction crisis under control. And now we're seeing, largely as a result of the coronavirus pandemic, this resurgence in overdose and addiction. And this is very troubling. So now onto your video question, and this is relating to the previous few slides that we're looking at social isolation and addiction, specifically in relation to COVID-19. So you got a video that's just a few minutes long from the Washington Post called Coronavirus and Addiction Recovery, Fighting Isolation to Stay Sober. The link is on Inquire. So you can watch that video, and then once you watch, answer the following video question. How has the COVID-19 pandemic affected those in recovery from substance use disorder? All right, so at this point you can pause, go watch that video, answer that question, and then come back when you're done. So the last thing that I want to briefly mention before you do your closing question and then we're done is the idea of a network analysis. And in the Fowler and Christakis article that you read on social networks and happiness, they did what's called a network analysis. This is an important component of public health and social science research more broadly. A network analysis is typically a set of analytic methods, and these methods seek to represent connections and the patterns within those connections among individuals. For example, maybe we're seeking to identify shared characteristics within social groups. So shared characteristics could be a shared set of beliefs, a shared set of behaviors, and maybe we see clustering in a larger social network where we have certain clusters of people who interact a lot with each other and also tend to share the same kinds of beliefs or behaviors. Maybe we're looking to see whether these characteristics actually spread across the social network. And that was really what Fowler and Christakis were trying to get across in their paper, the spread of happiness. Is happiness contagious? That was really the point of their analysis. The diagram that you see on the right side is an example of a type of network analysis, and we see different dots here that all represent different people. And the colors represent characteristics that align with those people. Maybe we want to see if there are clusters where a lot of people are the same color and clusters where a lot of people are different colors. And this is actually pulled right from the Fowler and Christakis article, and so they're looking at happiness, right? And that's what these different dots represent. You can also get a sense of how people are connected to one another and the interconnections between them. Right? Do we have a cluster, as we might call it in a network analysis, of people who are highly interconnected, a really tight-knit group of friends, for example? So there are some key terms here that will help you to better understand network analysis. I'm not going to go through all of these. They are defined and described within the Fowler and Christakis paper. So please do take a look at that. But you'll see terms like ego, alter, node, tie, and cluster. And these are describing the structure of a social network, okay? I'm going to leave it at that. And your closing question is going to ask you to really discuss the Fowler and Christakis paper. Here's your closing question for this week. And it is just asking you to summarize the Fowler and Christakis paper in two specific parts. Summarize the research questions that they pose. So what is the purpose of their study? And then summarize what they found. And this does not need to be a complete overview of every single finding that they have, but what were the big takeaways for you for this study? You can also, if you want to put down any questions you have or anything that was unclear in the paper, I know that it is a rather complicated paper in the methodology, but I think that the idea behind it is actually quite simple. All right, so just briefly describe the research questions and the findings. And if you do want to put any questions down as well for your closing question, you can do that as well, okay? So you can pause, do that, and then come back for the final slide.
Okay, that concludes our PowerPoint module for this week. Remember that for class this week, we are not holding class on Wednesday, and all students are meeting Friday on Zoom during our regular class time, 9:40 to 10:40. In class, we're going to discuss current research examining linkages between social relationships and health, and also consider some contemporary examples. So please do come to our Zoom class prepared to discuss. I'll see you all on Friday.